Welcome to Sidelined, your dose of analysis on the biggest injuries and conditions affecting sports today. Featuring insights from the doctors of Palm Beach Health Network Physician Group in partnership with ESPN West Palm. Now, here's your host, David DePino.
Welcome to Sidelined Podcast. We're here with Dr. Kaveh Asadi, a pediatric neurosurgeon with the Paley Orthopedic and Spine Institute, and Director of Pediatric Neurosurgery at St. Mary's Medical Center in West Palm Beach. Dr. Asadi specializes in brain and spinal disorders, including concussion. Dr. Asadi, how are you doing this afternoon?
Great, David. Thanks so much for having me.
And thank you for joining us on this Sideline Podcast. Dr. Asadi, we met last week, and I asked you, besides football, because, you know, we're thinking concussions, we always think football, but I asked you which youth sports, I should say, have the highest rate of concussions, and I was a little surprised when you answered girls soccer.
Yeah.
I found that interesting, to be honest, because girls soccer is rarely in the top of the discussion on concussion, in my opinion, what I see in the news. But tell us what you found in your expertise in treating this neurological ailment. Why are girls soccer athletes so susceptible to concussions?
So, you know, David, that's a very good question. So soccer is indeed like the number one cause for concussions in female athletes versus in male athletes is football, rugby, ice hockey, wrestling, and for girls being soccer number one, followed by lacrosse and basketball. And it's more like, you know, we think it's related to the mechanism, how actually like concussions or this type of brain injury occurs, that the forces applied on the head and neck area are which lead to concussions are more rotational, meaning the head and neck are being rotated to one side, and the connections from the brain to the spinal cord, to really the rest of the body are being stretched and disrupted, and that seems to be really causing the concussion versus like, you know, a direct linear hit. If you imagine someone like, you know, running straight into the wall, it still causes a pretty good head injury. But again, for concussions, seems to be that rotational, like, you know, force, which again is so prevalent in soccer.
That's really interesting. I wouldn't have thought of the rotational force. That's why we have experts on the show to let us know, you know, the latest in neurological care. In a 2021 article published in the Journal of the American Medical Association, known as JAMA for short, and Nature, a survey of more than 80,000 high school soccer players found girls are much more likely to suffer a concussion than boys. On average in this study, this 3-year study, almost 2 times more likely. This was in 2018 and 2019 that the study took place. The majority of the data was taken there. Showed about 189 boys and a whopping 296 girls out of 80,000 high school athletes suffered a concussion. Neuropathologist Willie Stewart at the University of Glasgow in the UK, who led the study, mentioned that concrete data is lacking in girls' concussion cases. Dr. Asadi, do you think with more focused outreach and data on these types of concussions with girls, we talked to start out with soccer, could help in limiting this neurological disorder?
Absolutely. Again, it's concussions, no matter if it's like, you know, young athletes, boys, girls, is like, you know, raising awareness is really one of the big things. And then one of the key factors for concussion it seems to be, believe it or not, getting smart about it, how to prevent them. And really that's where it comes into play. You know, you might ask yourself, or like, you know, the listeners might be asking, well, if girls' concussion is so prevalent, let's say in playing soccer, how come they're not wearing a helmet? And the reason is simple is your helmet, no matter if it's like, you know, more the softer helmet or the hard helmet, like during football or like, you know, hockey players wear, it's not really preventative for concussion. They help with more severe brain injury, with skull fractures. But what seems to be key in concussion prevention for athletes is the way they tackle and the way they identify symptoms. And that's where really a lot of the focus is going towards. There are some female soccer players who wear a helmet. They're like softer usually and more the spongy kind. But even those, they don't, in their studies who actually looked exactly at that question, they don't seem to be lowering the likelihood or the chances for concussion.
Again, fascinating information. We're here with Dr. Kaveh Asadi. He's a pediatric neurosurgeon with the Paley Orthopedic and Spine Institute and director of pediatric neurosurgery at St. Mary's Medical Center. Dr. Asadi, you're a huge football fan, especially the Liverpool Football Club in the English Premier League and FC Barcelona and La Liga. As a fan, have you noticed concussion on the rise in the ranks of professional football? You're watching on the pitch because, just doing the research lately, I've noticed it a lot.
So, I don't know if necessarily a rise. I mean, there has been steady state as far as the concussions in professional soccer. Is, I want to say in male professional soccer is not, I don't want to say it's under-recognized, but it's not as much out there than, let's say, in professional football. American football, that it's and it's not due to a lack of awareness, and the guidelines for professional soccer players is no different than for youth soccer players than it is for football players and hockey players. You name it, it's the same principles, same guidelines, how concussions are being identified, the sideline test, when players are safe to return back to competing and to play, and it's for sure there. It's maybe not as common as some of the other sports where again it's I don't want to say every game, but it's a lot more obvious, and we see it a lot more.
Going a little bit back and forth here into pediatrics and adults, but going back to pediatric care, have you seen a rise in concussion cases as a pediatric neurosurgeon?
Maybe not a rise. It has been over the past having done that now for over 10 years as far as focusing on sports related head injuries. It has been a steady state. If anything, I want to say there was a blurb of where it got maybe a little less, but that might be on my own perception. It has for sure not significantly, let's say, decreased over the years. It's still a major issue, especially in kids and young athletes who sometimes suffer significantly as a result of the downstream problems of the concussion.
Well, that's great to hear. Maybe a little decrease, and I think that's a testament to great medical doctors like yourself, as well as the outreach and awareness for concussion. I think we've definitely put at the forefront here, certainly this year, but and rightfully so. What are the 5 signs of a concussion? Coaches, players, teammates, parents, anyone can look out for to maybe say, hey, there's something wrong there that player needs a little treatment or care.
Yeah. So again, concussion is can vary quite significantly from individual to individual. Some of the more common signs and symptoms are headaches, dizziness, getting sensitive to light or sounds, balance issues, memory issues. We observe that fairly commonly. It can be only, let's say, for 30 minutes, an hour to a day, or sometimes even longer, where the kids are actually having problem once they're back in school with retaining new information and remembering. And more physical signs, like getting fatigued and just not feeling right. So the symptoms are very broad, and that's really where it becomes very important that the second a child there's just something not right about them, that they seek care either with their pediatrician or again someone who is more experienced in treating a child with head injury.
And if they have some of those symptoms, why is it so important to get an evaluation from a neurologist or a neurosurgeon like yourself, go to the emergency room and get the whole process started? Why is that so important?
Yeah, absolutely. So it's super crucial because of really two things. One is obviously identifying that there was a concussion and initiating therapy. And the second one is to guide the families and the athletes to when it's safe to return back to school.
We're here with Dr. Kaveh Asadi, a pediatric neurosurgeon with the Paley Orthopedic and Spine Institute and director of pediatric neurosurgery at St. Mary's Medical Center in West Palm Beach. Dr. Asadi, when a child or adolescent is seen by a pediatric neurosurgeon for evaluation for concussion, or a neurologist for that matter, what are you actually looking for to see? Are there telltale signs? I mean, you've gave us so many symptoms and criteria, but it seems like it can be a very complex situation with concussions.
So that's for sure. As far as the level of complexity and just the sheer number of symptoms the child can experience, it starts with just talking to the kids, talking to the families, and just listening to them what problems they have. Obviously, their neurologic exam, balance testing, eye-hand coordination, and there are certain things which we certain exam components which we might use more common in kids when we are suspecting a brain injury. And then there are very specific neuropsychologic testings to test for cognitive function. I want to say that is as key as identifying physical symptoms.
And just bouncing back to older athletes too. This is in the news. That's why I wanted to bring it up. Recently, a widow of a former college football player for the USC Trojans, University of Southern California, Matthew Gee, who died of CTE, a degenerative brain disease, sued the NCAA, National Collegiate Athletic Association, recently. Gee's wife is the plaintiff here. In 2013, she said her husband became angry, confused, and depressed. This is after he had, retired from football, hadn't played in 20 years. He told a doctor that days would go by without him being able to even recall what happened. How and why do concussions cause brain memory loss and impairment?
So that is this is a very important topic where we're learning more and more as far as the why this is happening. As you might recall, I want to say it was around about 9-10 years ago or so when the NFL went through this, and there was that big lawsuit, and then the player association with the NFL, they ended up settling exactly over this, that football can cause a CTE, and there's a whole movie and there's so many books written about that, which really the key here is, or boxing is another one where it's very well known to us that it causes chronic damage to the brain, which goes way past the active time players are involved in their sports, meaning way into their retirement area. And those are just signs of micro trauma, tiniest little hits to the brain repeatedly over and over, which if you imagine little scars on the outside of your body or on your skin, they might heal, but you still see tiny little nicks and little scars, and the same seems to be happening on the inside when we look at the brain of players who had repeated brain injury, and nowadays we can even do it in real time with a very sophisticated, it's called MRI technology, or when where we even look at the white matter tracks, which are the cables, the fibers, how the different parts of the brain and the neurons are talking about to each other. It's we tend to see that those fibers and those tracks are disrupted as a result of the repeated injuries, and not all of those injuries can heal, and they just leave scars. And if it just adds up, one scar after the other, and that's ultimately in a very simplified way results in CTE.
Fascinating look into the brain and concussion here, and you made it very understandable with the scars. That for someone common that doesn't have that same type of medical knowledge, that is really easy to connect with. That study I was pointing at in 2016, research done at Boston University's CTE Center, showed a link between football and CTE, which is associated with memory loss, depression, and progressive dementia. They found that CTE in the brains of 110 of 111 deceased former NFL players and 48 of 53 college players who played college football who were, in the study by JAMA. So there's definitely some fascinating statistics on this as well. The issue of concussion in sports and football in particular has been front and center in recent years as this research has discovered more long-term effects of repeated head trauma and problems ranging from headaches to depression, sometimes early onset Parkinson's or Alzheimer's disease. Is it true that repeated concussions like this can cause brain and nervous system ailments later on in life, or is that something that, is still being with research, still being discovered?
So a little bit of both. So it's for sure, still a matter of research and discussion, trying to understand how repeated injuries to the brain result on those permanent or long-term mental disabilities, or again, things like Parkinson's or memory issues, Alzheimer's, personality changes. It seems to be a true link. So it's not just anyone can develop Parkinson's, and so do professional athletes who had repeated head injuries. There seems to be statistically, as you pointed out nicely, a significant increase, and again in players who are involved in sports where it's just the number of hits they take to their brain. And it's not just for football, boxing, for instance. It's a very well-known sport where, again, one of the main purposes of that sport is, I always joke there are two professions which are being paid to cause brain injury. One is boxing, the other is neurosurgery. Each time we do brain surgery, we are causing a form of traumatic brain injury under very controlled conditions. But it's so those things don't go don't go unnoticed or unpunished. And so there is a lot of research focusing on that portion of things. And again, until not too long ago, a lot of that research was focused on after players or patients were deceased. Nowadays, more and more we can actually study those pathways and what actually happens to the brain in real time with newer tools which are available to us, either imaging but also molecular diagnostics, where we see that certain factors which are responsible for stress and traumatic responses within the brain are significantly increased. And on the positive side, obviously the more we understand about that, hopefully someday we will have very specific treatments for traumatic brain injuries or concussions, which are actually directed towards some of those pathways once we start understanding them. But that's again really exciting, rapidly evolving field of medicine.
Fascinating info on concussions and the brain as well. We talked a lot about concussions. What other types of pediatric neurosurgery care do you specialize in?
I specialize a lot in minimally invasive or minimally approach surgeries involving the brain and the spinal cord. The list is long, but again, if we want to tie concussions into it, which concussions per se is not necessarily a surgical disease, but again, us neurosurgeon, the reason I for sure started being more interested in concussion is because we see so many patients with not only traumatic brain injury, but the healing process after we perform surgeries on the brain or the spine. As a matter of fact, it's the same idea, spinal cord injury is the same mechanisms which we apply to get a child back after surgery, back to school, back to play, back to just being a normal kid, or doing everything they like and you enjoy. And it's the same mechanisms which apply for concussions. And there, again, that's where the minimally invasiveness or the more gentler approaches come into play to apply for surgeries to limit the damage to the tissue, especially to the nervous tissue, to make the recovery smoother, but also to prevent long-term issues.
What age range of patients do you see?
So age range is really anything from unborn babies, where we counsel new parents, and now that we are doing more and more prenatal diagnostics, we already find congenital malformations of the brain or the spine, but anything up to 18, 20, young 20s, or sometimes even older if it's a very specific condition which is more prevalent in the pediatric population, and us pediatric providers are more used to those conditions. But again, I want to say the vast majority of my patients are anything really infants to 18-year-olds.
Great to know. So you can provide neurological care for high school and middle school athletes as well as children who may have a concussion or any type of neurological ailment that requires neurosurgery care. So again, Dr. Asadi, great info. If there's anything else you'd like to add, but it was a fascinating discussion.
Yeah, no, thank you so much for having me, David. It was a great pleasure being on your show.
And Dr. Kaveh Asadi, once again, a pediatric neurosurgeon with the Paley Orthopedic and Spine Institute and director of pediatric neurosurgery at St. Mary's Medical Center. Both are in West Palm Beach on the campus of St. Mary's Medical Center. For more info on Dr. Asadi, visit paleyinstitute.org, where Dr. Asadi has a blog there with a ton of info on his site. So paleyinstitute.org/blog, physicians Kaveh Asadi, that's KavehAsadi, or to request an appointment with his office, call 561-844-5255. We'll talk to you next time on the Sideline Podcast.